somewhat of a shallow vestibule, certainly at the implant site. Significant recession on the right central incisor and a papilla level that means we're not going to cover any of that implant, and maybe half of the root of the central incisor. So mostly this will be for augmentation to try to maintain this implant. The implant might be angled a little bit, but if you look at the position of the crown, it looks like the tooth's in lingual version. I don't think the implant is. I don't think it's in a bad position, but it's maybe a little bit prominent. A little bit of recession on the patient's left lateral incisor, none on the canine, but the tissue is very thin. So to access this area with a tunnel prep is rather difficult. So we will use an access incision through the papilla between the canine and the lateral on each side, and that should give me better access to do the development of the tunnel across the midline and access to augment the patient's left canine. So we'll make an incision between the canine and lateral incisor and the papilla. And we'll do that on each side. Turn toward me a little bit. And this is just a layer of papilla, so it has a very thin facial to lingual thickness. And the rest will be tunnel. So I'll use the in-cutting intrasulcular knife to simply press through the base of the sulcus to crest of bone around each tooth. Some of this may block.